Lack of exercise, a poor diet, and other bad habits can take their toll over the years. Preventing heart disease means making smart choices now that will pay off the rest of your life. Joining us now is Dr. Harry High, the Medical Director of Cardiology at the UNM Sandoval Regional Medical Center. Doctor, thank you for coming in. And as you said during break, you were on a mission. Okay, so let's talk about this. First of all, you hear heart disease all the time.
Right.
What exactly does it mean?
Okay, when we say heart disease, mainly we mean coronary artery disease, which is by far the commonest heart disease. And this basically consists of blockage in an artery. So arteries are like pipes, and within those arteries, cholesterol or other fats deposit, and they start closing that artery so that it gets blocked. Once it gets blocked, that part of the heart that was getting oxygen and nutrition through that artery's blood flow is no longer getting it, and that's what we call a heart attack. When a blood clot forms and closes up the remainder of the artery, then suddenly they don't get oxygen and nutrition. That part of the heart muscle dies, and that's what we call a heart attack.
Gotcha.
And the only way to stop it is to immediately go in and open that artery very quickly, either by a blood clot dissolver or more commonly now by a balloon that opens it up, puts a stent in there to keep it open.
Right. Now, if someone is experiencing something, is there a way that we can detect that maybe we might be having something going on? I mean, obviously we hear the signs of a heart attack, but are there other factors that we should be looking out for if we suspect we might be prone to heart disease?
Right. So when you do get a heart attack, you have severe chest pains, you are dizzy, you are pale, you are sweating profusely and so on. That's a heart attack. But in terms of prevention, we have to identify the symptoms of heart disease before that stage is arrived, because then that's a crisis.
Right.
So what are the common symptoms of heart disease? The most common symptom classically is pain in the chest. And this pain in the chest occurs across the upper part of the chest or in the middle of the chest. Sometimes it occurs in the jaws. Sometimes it's in the arms, mostly the left arm. And it can start from here and spread this way or this way or this way, or it can just be in the arm. There are people who have had work done on their teeth. They went to the dentist because they were having this problem of pain in this area.
Wow.
So that's the first thing. And very often it is not actually pain, it's a pressure, heaviness, sometimes an awareness that you're just getting not enough oxygen. So typically this happens in a person who's doing physical exertion.
Okay.
So the classic thing is, if a person is doing physical exertion and after walking, as one patient told me last week, "Doctor, I feel fine when I'm resting, but I start to walk and after a few blocks, I start having this heaviness and I keep walking and it gets worse, then I stop and within minutes the pain is gone, the pressure is gone, and then when I walk again, it happens again."
Gotcha.
So this is the classic symptom.
Gotcha. Now, what are some of the things that we can do to be preventing this? I know that you said you were on a mission really to start our kids young.
Yes.
Okay, so what can we do to prevent it?
Well, there are several things that we can do. First thing is diet. You have to be taking less of sugars, less of saturated fats, which contains cholesterol and triglycerides. And second thing is an exercise habit, a habit of not just laying there, sitting there, but being active, doing at least, ideally, 30 minutes of such exercise that takes a little bit of effort. You don't have to do marathon running, right? In fact, marathons actually have been recognized now as being bad because they are bad for your joints.
Right, okay.
Yeah.
Okay,
and
so
that
diet
extreme
and
exercise is not. Exercise that is moderate, just to get you a little bit a feeling of that you're doing some exercise, maybe break a little sweat. 30 minutes once a day goes a great deal, great way in preventing.
Well, that's really good. So diet, moderate exercise, 30 minutes. I think those are really easy guidelines for us to live by. And for more information on this, folks, I encourage you to head over to CASA.com, click on the Style tab. If you're like me and you have a history of heart disease, especially, take care of yourselves, look into it. Doctor, again, thank you so much for coming in.
Thank you very much.
Appreciate it.